Hello, Juliana.
Hello.
So for those of you that are with us today, thanks for coming. We're going to wait just another minute, just to get some people some time to get logged in. So thank you for being with us today. Appreciate that. How many are in, Kirsten? No, you're on mute, Kirsten. How many people have joined us so far? 22 people, thank you. So we had 60 people signed up for this class, folks, so bear with us. We'll give people another minute to get logged in here. We're going to start at 12:03, so about another 30 seconds. So thank you for being so patient. I appreciate that. We're at 24. Okay, well, it is 12:03. So hopefully by the time we actually start the actual presentation, we'll have most of our attendees online here. So we're going to get started. So hello and welcome to this afternoon's presentation, Symptomatic Varicose Veins, Minimally Invasive and Effective Treatment for Varicose Veins. Thank you for making your health a priority by spending an hour with us. I'm your host, Jeff Yoda, Outreach and Events Coordinator for Franciscan Health, South Suburban Chicago and Northwest Indiana. I'm excited for our team to share some great information and tips for you in today's webinar series. This afternoon, we will discuss causes of varicose veins, how veins work, treatment options, EVLT, and we'll describe what that acronym means, sclerotherapy, and results. So before we get started, I'd like to share a few housekeeping items. For this virtual event, participants are muted. So all you are muted. We ask that you remain muted to help us avoid background noise and interruptions. As you can see in the bottom left-hand corner there, if there's a slash across it, you are muted. You click on it and unmute. If you have questions to ask the presenter during the presentation, please type them in the chat window. See the chat window there? Thank you. We'll be answering your questions at the end of the webinar. Our awesome administrator, that's Kirsten, is taking care of everything on the back end. She's the one that's putting up these wonderful. So if you experience any technical issues, just type them into the chat window and we'll work to resolve them as quickly as possible. If you miss anything, no need to worry. We'll send out the recording of today's presentation to you in a follow-up email. Franciscan Health is home to some of the country's most well-respected physicians and clinical specialists. I'm excited to introduce you to two of those experts who will be part of today's session. Today, you will hear from Dr. Kevin Keele, who is an interventional radiologist practicing at Franciscan Health, Olympia Fields. Dr. Keele has 16 years of experience as an interventional radiologist. He earned his undergraduate degree and his medical degree at the University of Wisconsin in Madison, Wisconsin. He completed his radiology residency at the University of Illinois at Chicago and his interventional radiology fellowship at Northwestern Memorial Hospital. Dr. Keele loves that being an IR physician gives him the opportunity to provide great care with a minimally invasive approach. Also joining us today, Juliana, is Juliana Messer, nurse practitioner for interventional radiology. She will be your point person for questions or scheduling. So before we get started with our presentation, let's just do a quick poll question to see why you decided to join us this afternoon. The question is, why are you attending the seminar today? So please choose one of the following. A, I have unsightly veins and want to learn how to get rid of them. B, I have leg pain, aching, heaviness, or fatigue. C, or number 3, I have had vein treatments in the past. And then the 4th point, I want to learn how to prevent varicose veins. Now, choose one of those 4 options. Let's take a moment to give everybody, or most of the people in our audience, time to respond. Okay, looking at the numbers, all righty. Great, it looks like we have participants today's seminar who are here for many reasons, and the number one reason being, I have unsightly veins and want to learn how to get rid of them. That's 65% of you. That's great. Okay, so now, without further ado, please welcome our key presenter. Well, Dr. Keele's not here, so Juliana's going to take over. She'll explain why. But Dr. Keele, interventional radiologist, as we discuss varicose veins and how to treat them. Take it away, Juliana.
Hello, my name is Juliana Messer. Like Jeff said, thank you for the introduction. I'm the nurse practitioner that works here with Dr. Keele at St. James and Olympia Fields, and I work with Dr. Keele with all of our vein patients. So I'm usually your contact person when you call to schedule an appointment, any follow-ups or procedures, anything like that. I'm always your contact person. Additionally, I scrub in the procedure with Dr. Keele. He's the one who actually performs the procedure, but I am always there to assist as well. So you would be seeing me many times along the process as well if it's something that you find that you want to pursue. So Dr. Keele is, the nature of being a doctor, he got tied up in an emergency procedure, and he said he would be here in about 3 minutes. And that was about 1 minute ago. So I'm hoping within the next 2 minutes or so, he'll be walking in the door behind me. But before we get started to talk about the veins, just a little bit about the physician group that Dr. Keele and I work for. It's called Radiology Partners. So it's a leading hospital-based radiology practice with a commitment to clinical value and service. We have the skill and resources of a national practice, but operate locally to provide the best service for the patients, hospitals, and referring physicians we serve. We partner with Franciscan Health Olympia Fields to bring the most advanced interventional radiology care to the Olympia Fields campus. And then here are our main attending physicians that we work with here. Dr. Saad Ahmed, Dr. Rahul Arya, Dr. Kevin Keele, who will be here in a couple minutes, and then Dr. Anisha Martin. And then just a couple points about our values as a physician group here. Our values that we lead with are integrity, teamwork, excellence, service, and accountability. All right, so, most of you tuned in today, we saw because you have visible veins that you want to get treated. So a little bit of background of information about what is VenaCure EVLT treatment. It is a laser treatment or therapy that eliminates unsightly varicose veins. And here's Dr. Keele walking in just like I said. A couple little points before he joins us. There's no hospital stay, so it's a minimally invasive procedure. There's minimal to no scarring, rapid recovery, and minimal to no side effects from the procedure. So we'll get, into more detail about those, side effects and recovery and everything after the procedure a little bit later on. But the VenaCure EVLT system uses targeted laser energy to seal the vein shut and help patients look and feel better fast. And it is an FDA-approved procedure. So just like a few pictures that help show that, the results speak for themselves. The picture on the left is a patient before therapy who has these large bulging varicose veins. And, obviously it's kind of the inner portion of the leg, which is a common location for those veins to develop. And then on the right is a picture with after the VenaCure EVLT. It shows you that they, took care of the source of the problem, so you no longer have those large unsightly veins. And then a little bit more about varicose veins. What is the cause? How can we treat it? First off, varicose veins are very common. It's estimated that half of all middle-aged adults in the U.S. are affected by unsightly and often painful varicose veins. More than 200 million people in the U.S. suffer from varicose veins or spider veins, and women are twice as likely as males to develop varicose veins and spider veins. I think this is a good spot for Dr. Keele to take over, so he's coming in right now.
Hi there, I'm Kevin Keele. Thanks everybody for tuning in today, and sorry for the delay. That's life in medicine and patient care. Sometimes there's unexpected delays, and some procedures can take a little bit longer. But thanks, Juliana, for getting the talk started. And now we're going to talk a little bit about what causes varicose veins and the etiology, just a little bit of background about these. So it's an inherited genetic predisposition. It's thought to be hereditary. Most people who do have varicose veins, you'll find family members who suffered from the same condition. It's part of the normal aging process. The frequency increases with age. Hormonal changes that relax vein walls put women at greater risk than men. We definitely see more women than men. And other conditions that put excess pressure on the leg veins, including standing for long periods of time, obesity and pregnancy. History of blood clots can put patients at risk, and previous vein surgery and exposure to UV rays. This is a nice little pictorial about the venous anatomy. So what you see highlighted in the red box is the top one is your greater saphenous vein, and in the bottom red box is your small saphenous vein or your short saphenous vein. So these are the superficial veins, which are the cause of, which are the source of the varicose veins. And when these superficial veins don't work, your greater saphenous vein, your short saphenous vein, or accessory veins, the valves don't work like you see a picture of the valve. So instead of blood going back to the heart, from your legs back to the heart, going up like it should, if the valves don't work, blood can pool back down your leg and into branches of your saphenous veins, and the ones that surface to the skin are what we call varicose veins. Here's another image of your saphenous vein and its branches, big dilated, what we call tortuous veins, and the ones that surface to the skin become symptomatic and or what we term varicose veins. And then these larger bulging varicose veins can also interconnect with what we call reticular veins and spider telangiectasia veins, the little tinier blue and branching red veins that we also see frequently, in patients with the big bulging varicose veins as well. So when the valves fail, as you can see in the picture, normally in the far left blue shaded box, you can see blood flowing up, so from your feet back to your heart, which is the way blood should flow. But when your valves don't work, they'll flow the other way. You can see the arrows going down through the valves that don't work, and when blood pools back down, it results in basically poor vein circulation. So like this last sentence says, the resulting back pressure is termed venous hypertension, and that's what causes the painful varicose vein. So basically, poor vein circulation, blood pooling back down where it's not supposed to go, giving you a range of symptoms. So we're going to head to, we did the poll question first, okay? So this is our second poll question that we're going to present here. So.
And I'm back. Thanks, Dr.
Okay.
Keele.
Okay, yep.
Okay, so we've had some great information so far, but before we move on, let's test your knowledge with another poll question. Okay, so what are my treatment options for varicose veins and symptoms of vein disease? So please pick one of these options: compression stockings, sclerotherapy, injections, vein ablation, or all of the above. So let's take a little time and give everybody an opportunity to give their answer. I see we're up to 30 people that have joined us. So again, thank you for joining us. If some of you come in late, don't worry. This whole session is being recorded, so whatever you miss, you could watch later on. All righty, so here are our results. And majority of you answered all of the above, 86%. So well, again, we thank you for being engaged by answering our poll questions. While all the answers are correct, all the above is the best answer. So if you answered all the above, you are paying close attention. So congrats. So back to you, Dr. Keele.
Okay, thanks, Jeff. Thanks, Jeff. And we'll talk about each of those treatment option topics in the next few minutes here. So, so traditional surgical treatment for varicose vein disease is now. Is my camera back on? Is the camera back on to me here? I'm not sure if it is, or if it isn't. Does it need to be there, Jeff? But
I can see you, Dr. Keele.
Okay, sounds good. So traditional surgical treatment for varicose vein disease is a ligation and a stripping. What they basically do is clamp the vessel where the greater saphenous vein, the superficial vein, which is your greater saphenous vein, where it connects to your normal deep vein, your femoral vein. They'll basically clamp that off, and at the same time, they'll make a series of incisions, sort of flaying your leg open almost, and trying to strip the greater saphenous vein, which actually is at least a couple centimeters below the skin. So it was a little bit of an inexact science, and you really will find less and less people doing it these days with the alternate procedure that we can do now. The issues with traditional surgical treatment is it needs to be done under general anesthesia in a hospital setting. There's more significant postoperative pain from bigger incision and the more invasive procedure, requiring more prescription drugs to treat the pain, more significant bruising and tenderness along the treated vein, much longer recovery time, several weeks, and a high failure and recurrence rate. And of course, is there another option besides the surgical treatment? And that's what we'll discuss more today. So, the VenaCure EVLT treatment. So, to make it simpler to understand, EVLT, endovenous laser treatment. So basically, meaning endovenous from the inside of the vein, thus making it unnecessary to make a big surgical incision to get to the vein from the outside. So the search for less invasive techniques to treat varicose veins led the development to this procedure, the endovenous laser treatment. It uses targeted laser energy to seal the vein shut from the inside and helps people get better fast. Advantages of this less invasive treatment are it's much quicker, less than an hour and a half. Probably most cases can be done in less than an hour, depending on the severity of the varicose veins. We do it in an outpatient setting without a hospital stay required. Up to 98% success rate, immediate relief of symptoms, and you can gradually return to your normal activity very, very soon. No general anesthesia or hospitalization. And minimal to no scarring, and it's typically covered by insurance. So a little schematic of what the procedure involves is just a little tiny puncture into the skin. It's almost not even an incision. It's analogous to when you have to puncture your skin into your arm to get an IV. You don't make an incision. You just make a really tiny puncture, and then once you're into the vein, we thread a catheter, and through that catheter, we put the laser fiber, and we're able to sort of fry and destroy the vein from the inside, and your body eventually it will just resorb and break that down. And we often will only give just a relaxing medication before the procedure. We usually give Valium. As an adjunctive procedure to the laser vein ablation, in most instances with patients with somewhat significant varicose vein disease, we'll do an ambulatory phlebectomy or microphlebectomy. It's basically a mini stripping type procedure, less invasive than traditional surgical stripping, where you had to go after a vein that you couldn't see at the skin. They'd have to make an incision in your leg to try to find the saphenous vein. We just make tiny 45 millimeter incisions to remove your very superficial varicose vein. So it's performed under local anesthesia, usually in the same setting after your laser vein ablation, sometimes in a different setting a few weeks later. The tiny little puncture incisions are closed with just simple steri-strip bandages. This decreases inflammation when we take these veins out and prevents recurrence of these varicose veins, rapid recovery, and minimal interruption to your regular activity. Here's a nice pictorial of what the phlebectomy involves. So just a tiny little puncture incision. We use a vein hook to grasp the vein, pull it to the skin, and then we can ligate it from there. Postoperative care for the laser vein ablation and the phlebectomy procedure involves dressing the leg with a compression bandage. We place a compression stocking to make sure the veins stay nice and closed. Short walk afterwards. You can then gradually resume your normal activities. Avoid hot baths and avoid vigorous workouts for a short period of time, and then just over-the-counter pain medications. Follow-up after the procedure, we do regular ultrasound follow-ups. We do a series of 3 ultrasounds afterwards, and then we do a clinic visit at a month. And then if there's any adjunctive procedures, we can plan for those. If there's any residual varicose veins that may need another phlebectomy, or if there's if the patient wants their reticular or spider telangiectasia veins, we can plan for treatment with sclerotherapy, and we'll get into that shortly. What to expect after the procedure? Bruising is a regular occurrence, just a little bit of bruising where we're working. We're working inside these veins, and inevitably there's going to be just a little bit of leakage of blood under the skin, which is what a bruise is. Like any bruise you've ever had in your life, eventually goes away after a short period of time, after a week or two. A little bit of tightening sensation in the vein that is not uncommon. A little bit of tenderness along the site as well, and then usually just some Tylenol and Motrin is all that's needed for some pain relief. Now we'll see what some of the results look like, some nice before and after pictures. So on the left, you see before the laser treatment, and you see a network of bulging varicose veins behind the knee, and then you see afterwards those big bulging veins are no longer visible. Here's another picture in a common place, a decent-sized network of varicose veins on the inside of the calf. Before treatment, and then afterwards, the big bulging veins are gone. Here's another before and after, and another somewhat typical location. You see some veins along the front side of your thigh going down to the inside of your thigh, and even along the inside of your calf, and afterwards they've resolved. Yep, here's another one in a pretty typical location in the inside of your calf. Big bulging veins, especially that one there, and afterwards, you don't see those anymore. Now these are some really big veins here. So when you have varicose veins like this, not uncommon along the inside of the knee and calf, if we really need to do a phlebectomy of these, so we go after the laser vein ablation of the saphenous vein. But then if we didn't do a phlebectomy where we do like a mini stripping of these superficial varicose veins, some of them can stay open from some complex connections, but even more significant, if they sit there stagnant with blood and they're clotted, you can get a little bit of an inflammation, phlebitis. So we'd really like to do a good phlebectomy along with these and get a nice result, as you see here. Here's another very big network of veins on the inside of your thigh, which would require a phlebectomy, but if things when things go well, like it did here, you can see that you get a great result. There's been extensive research with regards to treatment of your saphenous vein and your varicose veins to show the safety and efficacy of the procedure. Just a little bit of data. So combined results for this VenaCure EVLT treatment show over 3,000 greater saphenous veins treated with this endovenous laser, up to 28-month follow-up, and over 97% have remained closed in these studies. Bruising and mild to moderate tenderness are not uncommon for a couple weeks. No other major or minor complications. There is a low risk of burns and some numbness from irritating a nerve and a deep venous thrombosis. We do see We have seen a few deep venous thrombosis over the years just from people being laid up. We put patients on blood thinners for a couple weeks and it usually goes away. We probably quote, our experience probably corroborates with over 97% success rate. A couple percentage of the time, somehow the veins do stay open. It's amazing what the body can do to heal and stay open. And when it does happen, we can go back and do a repeat treatment and without too much problem. As a similar related disease process, we've talked mostly about the laser vein ablation and the phlebectomy for your big, bulging, ropey varicose veins. These reticular and spider telangiectasia veins also often connect with these superficial varicose veins. So what you see is the little small blue, predominantly blue ones on the far right picture that you see, and then the little spidery ones on the far left, which tend to be blue and red. So we can do a sclerotherapy injection for these procedures, and we'll talk about this in the next couple slides. So sclerotherapy is an outpatient procedure, not unlike the laser vein ablation and the phlebectomy. It's performed for reticular and spider veins. These are most of the time they're not symptomatic, but they do occasionally cause aching, burning, and itching. It's a relatively quick procedure. We usually do it on a different day once you've healed from the laser vein ablation and microphlebectomy, if you do have those procedures. We use a tiny needle to inject medication into these veins. What it does is it doesn't surgically remove the veins like with the phlebectomy, but it causes them to fade. Instead of a blue and red, there'll be kind of a faded tan color that you'd have to look pretty close to still see the veins there. And the results are pretty quick. Sometimes you get a little inflammation for a few days and some bruising, but then you'll notice results pretty quickly afterwards. If you our nurse practitioner, who you met earlier, Juliana Messer, she is our coordinator for our vein clinic, and so you can reach her at the number listed here, and there's our scheduling office. If to go ahead and schedule a procedure or consult. So, but otherwise, that concludes our slide presentation. And so, thanks everybody for your attention, and we'll open it up to some Q&A right now. So, Jeff, I'll have you
Yes.
let us know what we have for some questions.
You bet. So thank you, Dr. Keele, for your expertise and for providing so much information regarding vein disease, varicose veins, and treatment options available at Franciscan Health. You did a great job. Thank you so much. So just a reminder again, folks, scheduling, if you'd like to get a consult to talk to Dr. Keele or Juliana, the scheduling office is 708-855-7558. And again, the nurse practitioner, if you want to speak directly to Juliana, is 708-852-2742. So we're going to jump into our Q&A. Yeah, thank you for showing that again, Kirsten. Appreciate that. So please jot those numbers down, important numbers. Again, I'd like to thank Dr. Keele, Rad Partners, a great group of physicians that we deal with. So now let's go into some Q&A here, and let's look at our chat box and see what people are saying. Moment. Okay, is sclerotherapy covered by Medicare? That's a question for you.
Yeah,
That's a good question. Sclerotherapy. What's that?
Follow-up treatment, but not.
Yeah. So it's often covered as a. So I'm here with Juliana answering this. She usually knows better than I do a lot of these things. So it's often covered as a follow-up. You said, Juliana?
If they've had a laser before.
Okay.
Yeah.
Okay, so if they've had a laser vein ablation treatment, so they'll cover a sclerotherapy. And some insurances will cover sclero, correct?
Yes.
Yeah.
Yep.
Okay, so some insurances will cover that. So it's something we always investigate before any procedure. If you see us, then we get pre-authorization and see what's covered beforehand before we proceed.
Excellent. Thank you for that answer. Let me see here. We have another question. So my legs ache and are swollen, but I don't have large varicose veins. Does that mean I don't have a problem with my veins?
Well, it's not uncommon to have venous insufficiency from your from the superficial varicose, from the superficial saphenous veins where the valves don't work, and it can lead to swelling and discomfort, and sometimes the varicose veins are beneath the skin and you just don't see them. So you certainly could have venous insufficiency. You often want to make sure you've seen your primary doctor and make sure you don't have a blood clot in your vein. But if that's been ruled out, if you just have swelling, it's certainly worth worth an investigation either through your primary doctor or through us to see if you might have venous insufficiency.
Excellent, thank you. This may be a question for Juliana. Is this considered in network for the SPI Blue Cross Anthem insurance?
Yes, it is.
Okay.
Yep, we're in
Short and
network with SPI.
Short and simple. Very good.
Yes.
Any other questions? We have 33 participants, so we've had a few more people join in. Again, if you came in late, we recorded this session. So anybody that signed up for this, you're going to get a follow-up email with recording of the session. So if you missed anything, don't worry. We got you covered. Everything's been recorded. So you're good to go. Any other questions before we, oh, here we go. Here comes another one. Thank you, everybody, for your questions. We appreciate it. What is the normal cost for these two procedures out of pocket versus insurance paying? Are consultations free?
So,
Can you repeat that?
No,
So what is the
usually,
normal cost for these two procedures out of pocket versus insurance paying? Are consultations free?
so usually when you meet with a physician for a consultation, I think there is a fee. I can't tell you exactly what it is because we have to dictate a formal note that we saw you, that we evaluated you, that we did a history and physical, and then we use that note as documentation to submit to the insurance company along with any ultrasound tests that you've had that basically are evidence of venous disease. And that is how your insurance company makes a decision whether or not they'll approve you to do the procedure, because they do have, they do cover the EVLT procedure and the phlebectomy and oftentimes the sclerotherapy, but they want to see, you have to meet certain criteria and you also, have to have evidence of vein disease. So that is why we have to have a formal consultation note so that we have something that supports medical necessity to submit to your insurance company. As far as the exact numbers, I'm actually not sure because neither of us work with the actual billing for the procedures, but we could certainly give you a contact information to someone who would be able to provide that information for you.
sure.
Very thorough, very thorough. And we got a lot more questions popping in, so I want to thank the audience for your questions. Next question. My mom had venous insufficiency most of her life. I'm at a higher rate of getting this. Am I at a higher rate of getting this? She was diagnosed at the age of 35. I'm 65.
Yeah, it means you are at increased risk, but it's not a guarantee. So if it hasn't happened, there's nothing you really need to do. There's things you can do, just practice in a healthy lifestyle to try and prevent it. Just eating well, staying in relatively decent shape, walking, standing in one place for a long period of time puts pressure on your legs, but walking is good. It gets the blood pumping. So, but if you haven't manifested any symptoms, there's nothing you really need to do for any kind of treatment. Just need to practice overall good health.
And she, the person that asked that question, she did respond by saying she did control this with stockings, Dr. Keele. So apparently.
Okay, yeah. And if this is more or less done for quality of life and symptom control. And if patients are happy with the conservative measures they've used, then that's perfectly fine. Unless it's progressed to swelling and skin changes, which can lead to skin ulcers, then it becomes more of a medically necessary thing beyond just pain and interference with your daily life. So, but otherwise, if you're able to manage it to a level that you're comfortable with, then you can certainly hold off on treatment.
Okay, we have another question. We have actually 4 more in our queue. The medicine which is injected into the vein to collapse it, does it go to the heart or any other organs? where does the medicine actually go?
Yeah, well, much of it, so that's a good question, because it is injected into your vein, and a lot of it will stay in that vein and the vein wall and sort of be toxic to the small vessels. Some of it will go into your veins, into your general circulation. So we're limited by how much we can use. We have a maximum dose. So we have a maximum dose that we can use when we do the sclerotherapy. And that dose takes into account the fact that if all of it were to get into your vein system throughout your body, how much of a level is that concerning? Because immediately once it gets into a big vein, it gets diluted and doesn't cause a problem, as long as you're not injecting too much. So, if you went someplace and they did sclerotherapy for 3 hours on you, I'd be a little concerned, because they'd be using too much. But we have a limit to how much the dose we could give. That is a good question, because some of it's always assumed to go systemic in your veins.
Excellent, excellent. Thanks for that answer, Dr. Keele.
Mm-hmm.
Our next question. I've had large varicose veins in both legs for over 20 years. Is it too late to act on this now? Also, where are you located?
It's absolutely not. There's, people have had long-standing disease for some time. You're probably going to have some skin changes, which, just from some chronic deposition of a little bit of blood in your skin. So like what we call hyperpigmentation, that's probably not going to go away, but the veins can absolutely be treated. We can treat the source saphenous vein and then do the phlebectomy of the superficial veins too. So it's not too late at all. And we're located at Franciscan Health, Olympia Fields Hospital, formerly called St. James. So just right in Olympia Fields at the corner of, help me here.
Crawford and 203rd Street.
Okay, Crawford and 203rd. And
The
Bowman on the other
actual physical address is 20201 South Crawford Avenue, Olympia Fields, Illinois, 60461.
Yep, and we do the procedure in sort of a more of an outpatient setting within the hospital itself. It's not really in the main hospital. It's in the Heart Vascular Institute. So,
which is connected to the main hospital.
Yes.
Okay, thank you. So next question. My cardiologist is in Munster through Franciscan.
Mm-hmm.
Do you do all the area procedures?
Yeah, we can really see any anybody that's is within a convenient drive to our hospital. We're certainly willing to see. Who's going to be Northwest Indiana. Anybody that wishes to come see us and receive what we consider to be high quality care. We've been doing this, as part of our parent group for, almost 20 years now. So that's when we first started the initial vein clinic. Probably not quite 20, maybe like 17 years ago. So, we're vascular interventional radiologists. So we're sort of the expertise in being able to diagnose, treat, and manage, disease of the blood vessels. And we have really good technical expertise to be able to use our ultrasound skills to get precisely inside the vessels where we need to go in order to give the best chance of successful treatment.
Very good, thank you. We have several more questions here. There's still 4 in the queue. How does varicose problems affect the feet?
In general, when you have varicose veins, it's a sign that there's venous insufficiency. So the saphenous veins, the valves don't work, and blood, instead of just going right back to the heart like it should, it goes through a redundant loop in all these branches and eventually gets back. And that often leads to swelling. Swelling is going to happen more in your lower leg than your upper leg, and often in your feet too. So veins are different than arteries. If you have problems with your arteries not giving good enough flow to your feet, that's a different story. But we can also evaluate and treat patients for that. But that's a different process where if you have problems with your toes or your feet, or if you have any wounds or scrapes or anything like that haven't healed, that can be an arterial problem. But if you have swelling and achy pain, and especially associated with varicose veins, that's how it can affect your lower legs and your feet much more than your calves and your feet more than your thighs.
Excellent. Thank you, Dr. Keele. The procedure is done outpatient at the doctor's office, so we are not charged hospital costs. Does Medicare cover the procedure? I think we answered the Medicare question already, but I'm sure you can reiterate that. But again, is the procedure, I'm sorry, went away. So did you catch that?
Yes,
Yeah.
yep, and we did. We do have to submit for Medicare pre-authorization for this procedure, or for the EVLT procedure, and we do document it as an outpatient procedure within the hospital setting, because the hospital has a certain identification number that we do use, so they know it's a hospital, but we do classify it as an outpatient procedure.
Excellent. And then again, the Medicare question, I believe we said that was covered, correct?
It is covered, yes.
Right.
Yeah, as long as you meet the criteria.
Excellent. All right, here's our next question. If you have this procedure, can you start developing varicose veins in other areas?
So if you have a successful procedure where we treat the offending saphenous vein and we do a phlebectomy of your varicose veins, you know, that leg, those varicose veins that we take out and throw in the trash bucket, like I tell patients, that's not going to give you any more problems, and those veins will be treated and not come back. Now, new veins can develop. There are accessory saphenous veins that can develop over time. It's usually years, sometimes 5 or 10 years later, some new varicose veins can develop, because oftentimes patients are prone to this process. The ones we treat immediately won't recur, especially ones that we take out, that obviously is not going to recur. New disease can develop. Most of the time it won't, but new disease can develop, usually many, many years down the road. If it does happen, we can come back and do a repeat treatment. We certainly see that every now and then in patients. We've been doing this long enough, so we'll see patients that we saw 10 years ago and they saw something else pop up. Usually not quite as severe as the first time.
Excellent, thank you. This came through the chat portion of the session here, so I'm going to jump to this question, and then we'll get back to the one in the Q&A section there. I am morbidly obese. Does it make sense to have the procedure? Also, I cannot tolerate compression stockings. They are extremely painful. Is there something else I can use after the procedure?
Yeah, we'd evaluate every patient on an individual basis, and we certainly have had patients who can't wear the compression stockings, in which case we use a tight wrap afterwards. So, depending on the varicose vein disease and, the exact body habitus, we'd be able to make an assessment. Some patients just, may not be able to have it, and so we do the conservative treatments, but, most patients we're able to make work.
Okay. So the morbidly obese, is it still, does it make sense to have the procedure? That would be yes, correct?
Yeah, in many cases, yes. They'd all be, we can't make a blanket statement. Every patient would be evaluated on an individual basis, but yeah, it's not an absolute contraindication by any means.
Very good. Next question. What are long-term effects of leaving veins untreated?
Well, it's a good question. So when if you have varicose veins, they're not going to get better on their own. They're not going to disappear, even if you take good care of yourself. If you do take good care of yourself, practice good lifestyle modification measures, wearing compression stockings when you need to, going for, daily ambulation, watching your weight, et cetera. If you do those things, it may not get worse. It may stay stable. But if it does get worse, what the progression often is what we call venous hypertension or venous insufficiency, and then where your veins just aren't bringing blood back to your heart as quick as they can. So you have swelling. So chronic swelling can often lead to what we call venous stasis skin changes. So your skin can become discolored, and in the more extreme situation, you have skin ulcers. So we have skin ulcers that develop from this venous insufficiency. Kind of a typical pattern is in the inside of the lower part of the calf, and and then when it gets to that stage, you definitely need to come in and see us to give you a chance to get on track to heal.
Excellent. And then here's the last question. I believe this is our last question. This may be a broad brush question. What is the required criteria?
Yeah, that's a good question. So when you know, insurance companies are asking for criteria in order to treat, and it's usually, you know, they often want to see that patients do truly have symptoms, and, you know, you have to be truthful in a consult, and you have to see, is a patient bothered? Do they have, you know, do they have pain, you know, swelling, et cetera? And it's not just pure cosmesis. And then oftentimes some insurance companies will require conservative treatment for a period of like 6 weeks, or 6 weeks oftentimes. So that means you see us in an initial consultation, we give you compression stockings and tell you about conservative measures. And if you haven't gotten better after 6 weeks, then and we document that it's okay to proceed with treatment. So, you know, they're just, you know, sorry. And another criteria is the ultrasound needs to show specific criteria, that there is reflux in the vein, meaning the valves don't work, and it's, you know, at a certain level, it shows reflux for a certain amount of time, and, you know, the veins are a certain size, et cetera. So there's some complex ultrasound criteria that would be, you know, diagnosed at the vein mapping, and then some patient condition criteria.
Well, we have a very inquisitive group here, Dr. Keele, because 2 more questions just popped up in the queue.
Oh, sounds great. Yeah, I'm all ears.
One is,
I haven't been stumped yet.
Okay. Well, this one, I don't know why they're asking this question, but I'm sure it's a good question. Can it be reversed?
Yeah, it's interesting. You know, the way to answer that question is people ask, do I need these veins? Is it a problem when you take out this saphenous vein? Because we often have patients ask, well, I heard during a bypass, they take a vein, like a saphenous vein in your leg. That's a great question. The issue is when we see patients with these valves that don't work and varicose, big dilated varicose veins, the saphenous vein is big and dilated, and they would not be able to use it for a heart bypass or a bypass anywhere. It's basically kind of a shot vein, so to speak. So it wouldn't serve as a good conduit. So not only is that vein not helping you, it's hurting you. It's slumping blood away from your normal deep veins and going into these complex vein networks. So the veins it's only causing problems. So it doesn't need to be there. There's no need to have it reversed. Now, sometimes the vein does open up. It closes and then opens up, and we'll see that in these first few ultrasounds. It's just an example of the body's amazing ability to heal itself, because you'll scar down a laser and it'll heal up, or scar down with a laser the vein, it'll heal up and open up. So sometimes it does open up on its own, but it's already been a little bit damaged by our treatment, so it's pretty easy to do a repeat treatment. So there's no need to reverse it, and there's no need to worry about preserving these veins, because the only veins we treat are ones that are already no good and they couldn't use for surgery anyhow.
Excellent, excellent, thank you. All right, this one's an interesting question. I was to have, I'm gonna try to enunciate this, Venasio, Venasio. Thank you.
Yeah.
I knew I'd butcher that. Done this past December, but Franciscan's insurance would not pay for it. It states it's experimental. Would that procedure you do be as good as Venasio?
Well, this is one of the rare times I may side with an insurance company. You know, Venasio is certainly interesting. It's you know, it's basically a sclerotherapy of your saphenous vein, and it hasn't been around for as long. It's not as tried and true. I feel like it's a little more imprecise, and it's, you know, it's interesting that it's maybe even a little less invasive and more well tolerated, because you're not using any heat. You just put this in. But, you know, I think there's definitely some problems with it too, because you've got this vein that's going to be big and dilated and inflamed for a little bit longer, and it's not as proven as laser vein ablation. So I think our treatment's better. If that was better, if I thought that was better, we'd switch to doing that, because we do all sorts of similar procedures, and, you know, it's certainly something we could do, but we're not sold on that. We personally like this better. Excellent.
So it appears our viewing audience ran out of questions. Wow.
Oh, man.
That was great. I want to thank you, Dr. Keele, and Juliana. Juliana, stick your head in there and wave.
Oh, yeah.
Yeah. Sorry, yeah.
There you are. Thank you, guys. That was very phenomenal information. Hopefully our viewing audience felt the same. I learned a lot, so thank you so much. So once again, we'll send you an email with recording of this session. Oh, I'm sorry. Oh, Shirley, we don't, there's one more question. We want to get everybody, so thank you. Oh, and another one. Okay, so would your heart work more efficiently if the leg veins are treated and circulation would be better?
Yeah, it's interesting. I mean, it's a good thought. Varicose vein disease really hasn't been shown to put that much pressure on your heart. So, you know, it's so much further down the heart pathway. You know, you know, your heart's pumped all the way down to your leg, and then blood's coming back. You know, your muscles will, you know, just normal processes, you know, of blood flow will get blood to flow back to your heart. So it probably won't, you know, it's probably not going to hurt your heart to have varicose vein disease. It's probably not necessarily going to help it to get it treated. It's just too far removed from, you know, your heart, which is way up top.
Okay, and I'm sure this will be a quick answer, Dr. Keele. Then any other questions after this, folks? Feel free to send them. We'll answer them after the session. We'll send you an electronic email response to that. But our last question, would I need to take time off work after the procedure?
Yeah, it's a good question. You know, it's nice if patients can maybe take a week off for the recovery, but, you know, a few days, like if we do them like on a Friday, you know, take the weekend to recover, and patients can go back to work who really want to go back to work on Monday. But would you say most patients take a week off for a few days, or?
I think less than, I think usually just a couple days usually afterwards.
Yeah, usually just a few days, you know. So yeah, you'll be able to, you know, everybody will be able to judge how well they feel themselves, but you know, you can gradually resume your normal activities, and usually after a few days you can just about get back to normal, with some restrictions, of course. You know, no vigorous activity and swimming like that for a couple weeks, but more or less your normal activities of daily living you can resume after a few days.
All the more reason to get the procedure, right?
Yep.
So again, thank you, Dr. Keele and Juliana. You guys did a wonderful job. So thank you for spending your busy day with us this afternoon. So folks, again, remember this session's recorded. We'll send you that in an email, follow-up email. Feel free to watch it again and share it with your friends or someone who might find it helpful. You'll also receive a survey about the seminar and its contents. Your feedback is truly important to us and will help make further seminars better. So please take a few moments to fill that out. So on behalf of myself, everyone at Franciscan Health, Dr. Keele and Juliana, thank you for being with us, and have a blessed remainder of your day. Enjoy the weather. Thank you so much for coming. So long.
Thanks everyone.
Thank you.
Thank you guys. Oh, man.